Welcome to the BOUGIE BALDIE podcast with your host, Kellie Rhymes.
Society promotes beautiful long hair. They promote that as beauty. And because society promotes that as beauty, many women out here feel like if they don't have this long, beautiful hair, they're ugly. And that is far from the truth. Oh, I see you cut your hair. And I'm like, yeah. But then she's like, but don't you want to just leave a little bit of hair? Once again, did you ask me what was going on? Why I cut my hair? And so out of respect, because she was an older lady, in my mind, I wanted to say, do you know me like that? Like, you don't know me like that, right? Yeah.
I just feel like we have reached a pinnacle in society where there is a lack of respect for people that are different than you. Yeah. And I think it becomes a broader conversation that we need to have because everybody is different and we all have the right to speak to. Yes.
A lot of times when people approach us in a negative manner, it's because of a character defect or flaw that they have in their personality.
Mm-hmm. I think that us, along with the rest of the community, that we have some work to do because a lot of the questions and approaches that we get from folks who are not in the community is, I think, out of ignorance. And as baldies, I think we have the responsibility to start to educate and reach out more so that people can be aware and understand what's acceptable and what's not acceptable.
So I just left the office like, look, guess I'll just be wearing this wig. Didn't even know how to buy a wig at first. Looking a hot mess. Went to the beauty supply with my 60-some-year-old cousin and she wore a wig. And I'm like, I need help. And she's like, okay. We just trying to pick something out. It was a hot mess.
Yes, you don't think that bald women look good in a gown? Well, let me show you. Yes, we do. And we can still get glammed up and we still look classy and we still look beautiful.
But it was still very emotional when I first lost my hair and having to touch my head and see it in my hand and was just like, okay, this is very real.
She took my hand. She took my face on my hands and he said, honey, you are beautiful, but you really need to corner here. She said, I suggest you find a wig that you like and go from there. And I left her office bawling, but I also felt so good because for the first time someone told me something that actually made sense to me.
Right now, I could grow my hair back out, but I love being bald, so I don't. So I still feel those questions of, so when are you gonna grow your hair back up? Are you growing your hair back out? No, I'm not, because like Denisha said, I was born to be bald.
Hey, welcome back to another episode of the BOUGIE BALDIE podcast. Today we have another wonderful guest. Let me introduce her and let you know who she is. But before I do that, for those who are new, my name is Kellie. I'm a women's hair loss support and authenticity coach, and I help support you through your hair loss journey, going from that insecure person to that confident person, no matter what your decision is in regards to how you want to wear your hair. All right, so let's get into today's guest. Today we have Dr. Melissa Toyos. She is a summa cum laude graduate of Louisiana State University and a board-certified eye surgeon. She is a partner of the Toyos Clinic with locations in Memphis, Nashville, and New York City. Right. She works in the dry eye, ocuplastics,
Yes.
hair restoration, and director of research.
Right.
She was previously a partner at one of the largest eye practices in the country, Discover Vision Centers in Kansas City, Missouri. She also has extensive experience in the use of surgical techniques, lasers, injectables, and topicals to achieve face, body, and hair rejuvenation. Many public figures have utilized her skills to look their best. Dr. Toyos is a national researcher and lecturer. She trains other doctors on surgical techniques, consults for startup companies, and helps to create and design medical and surgical solutions. She has created a skincare line and helped Bausch and Lomb create their skincare offerings. Her clinical research has been used by the FDA to approve various medications and devices that are in the market today. She is a two-time award winner of the American Society of Cataract and Refractive Surgery Research Grants. She has published and edited over 100 publications and is a frequent lecturer at the American Academy of Ophthalmology. Correct?
Right.
Yes, got it
Yes,
right.
you got it. You got it.
The American Society of Cataract and Refractive Surgeons, and the Association of Research in Vision. Dr. Toyos devotes time to patient advocacy and community outreach. She is the former president of the Missouri Society of Eye Physicians and Surgeons. She has held various leadership positions with the AAO. She was voted one of Kansas City's most influential women and women who mean business in her community work, and one of Nashville's most beautiful people. In her free time, Dr. Toyos likes to spend time with her husband and 3 girls, and their dog is Augie. Is that correct?
Yes, Augie Toyos. Yeah.
Yes, that's a cute name. Welcome.
Thank you. Now that we got that out of the way, we can start having some fun.
Yes. So let's jump on in because I know you are super busy. So let's get into some questions because I know the audience really wants to know. Now, the audience is normally women who are experiencing hair loss themselves. So to get this information will be very, very beneficial to them.
Yeah.
So can you tell us about, well, let me just say this. You've trained and practiced as a ophthalmologist,
Right.
but you now lead hair restoration research and treatments.
Correct.
So what drew you from
How did I
your
get from
eyes,
beard
from
to
hair?
beard?
Yes.
That's a great question. And really all women deal with hair loss, right? To some degree, some more than others, some because of medical reasons, some just because of aging. But yeah, to some degree, we all have to deal with some thinning, miniaturization of the hair. So I think this is a great topic. And I love the ranges of approach from acceptance to scientific and innovative, and whatever resonates with an individual. It's great to have options and you can choose what works best for you. So my journey into hair was taking care of some NFL cheerleaders here in Nashville. And I worked a lot with them. They were contractually obligated. I didn't know this was a thing to wear the lashes. So that has a lot of implications for dry eye. It also has some implications for aesthetics because the glue can be very irritating. It can break. You're nodding your head. The same can be true for the extensions that they wear in their hair. So we were literally doing off-season rehab to try to grow lashes, strengthen them naturally. And the girls were saying to me, hey, would this work on my scalp as well? Because I'm having same issues. So this was around the time of COVID. I had a little bit of free time on my hands and I started just kind of diving into the science of it. And a lot of it actually was very interwoven with ophthalmology anyway, like anti-inflammatories, immunomodulators. Everybody's familiar, I think, with Latisse that grows eyelashes. It started off as a glaucoma medicine, interestingly. And we saw these senior citizens with like beautiful long eyelashes. And so there really is a lot of overlap, unexpected overlap between ophthalmology and hair restoration because of the complexity of the disease states that we commonly run into. And so it's been very interesting to me. I think the fine motor skills of being an eye surgeon have also translated into the eyelash, eyebrow, and hair beard restoration that I do in my hair transplant world.
Okay. And we're going to get into that a little bit more. We're going to talk about the eyelashes and the beard transplants because I did not know anything about that until I read your website. And I was like, what?
Yeah.
You can get
this? What's happening? Yeah. There's a lot to dive into.
Yes. And I was like, okay, yeah, we have to talk about that.
Yeah. All right. Put it on the list.
Yes, it's on the list. Now, before we get to that though, many patients become overwhelmed by the options they have. So we
Right.
have topicals, lasers, PRP, injectables, surgery, like all of these different things
Yes.
that we can use to try to regrow our hair or to get it back in some form of way, from,
Right.
excuse me, some form or fashion. So how do you decide which combination of non-surgical therapies to start with, and what evidence do you rely on to guide those choices?
That's a great, yeah, great question. There's so many different things. I usually start my discussion by just laying out all of the options for patients. I think it's very important that people know what the options are. Every option is not going to be right for every patient, but I like people to know what is out there, and then we can kind of talk about the pluses and minuses. Definitely have people on one end that just say, I'm not going to remember to do something every single day. I just want to do the thing. They mean surgery and then be
Mhm.
done with it. I have other people that say, I'd like to try something non-invasive and see what I can do. We really
Okay.
can do quite a bit getting people from here to there. And then some people want to do everything. So we do everything. So it's a conversation between myself and the patient and kind of see
Okay.
what their needs are, what resonates most with them, and what they think realistically could be something daily that they could do or not do.
Okay. Now, I mean, this is just based off of your answer. I have a follow-up question here.
Sure,
A lot
sure.
of times when it comes to the different hair therapies and things that we try to do to regrow our hair,
Right.
not covered by insurance. So
Yes.
are any of these things maybe potentially covered or would be covered maybe in the future? Or are there certain circumstances where it could be covered by insurance?
Insurance is such a terrible topic to talk about. I think in medicine, it's so frustrating for doctors, it's so frustrating for patients.
Yes.
I think the answer is yes, in some situations, things can be. It's usually not the good stuff, and it's usually not for a long time, and it's usually not without a pretty good fight. So,
Okay.
without going into the ins and outs of every single option that's out there. Most of this is cash pay for patients. And another thing we do in our practice, and I think some other practices are doing this as well, but I work with the SmartGraft people in LockRx, and
Hmm.
we are developing a genetic test to help people understand. It's just a little cheek swab, but it can help you understand how responsive you might be to some of the more common therapies like minoxidil and finasteride, prostaglandins, et cetera, immunomodulators. It also
Hmm.
picks up if you might be deficient on some vitamins, trace minerals, that sort of thing. And then, of course, I like to do a very comprehensive medical workup. We're looking for thyroid disease, and then, in like your situation, looking for biopsies,
Yes.
things medically that need to be picked up and might have systemic implications as well.
Okay. Okay.
Yeah,
Thank you for answering that.
sure, sure.
Now let's get into the low level laser therapy. So I know
Oh,
that's popular. Uh,
right,
What does the clinical data actually say about laser for hair regrowth, and how
right.
do you incorporate home device excuse me, devices
Yeah.
versus office treatments?
Great. Okay, so my husband invented a light therapy for dry eyes, and dry eyes are also pretty common among women of our age, Kelly.
Hmm.
You,
Uh-huh.
yes, women of our age, but really everybody who's on computers,
Yes.
allergy season's getting worse, so dry eyes are a very common issue among the women that I work with, and
Hmm.
he invented a light treatment that's now FDA approved. So we have been working with energy for about 30 years. Very intrigued by the idea that, you could kind of skip medicines and some of the side effects, and you can truly target inflammation with certain wavelengths of light. You can
Hmm.
regenerate, stimulate it's the P450. It's part of the cell energy mechanism. And if you could
Okay.
stimulate that, then they'll look and act like younger cells. So you can rejuvenate things that start to decline. Because, we all peak around 28, and then it's just kind of a nice little slide from there. But
The
little
downhill
slide,
slide.
yes. But we can jumpstart things again. And I love using energy to do that. And I love using energy to do that for dry eye, to reduce inflammation on scalps and regrow, because that's part of the aging process, is that the inflammation that becomes more unchecked after we turn 50. We're more prone to autoimmune diseases, women specifically. So those are all things that we think about. I do like to incorporate low-level light treatments. We have a red light cap that we use. I like the strong stuff. You don't know me very well, but I drive fast, I cook fast. I like things, I like results. So we use very powerful red lights, and there are many of them that, can cost you thousands of dollars, but they're just pennies to make in China. So you really want something that's going to be very powerful, have a lot of energy, have the data behind it, and as
Mhm.
close to your scalp as possible, because we know a lot of red light, if it doesn't touch the skin or get very close, a lot of it will just bounce off. So yeah,
Okay.
so those are some of the differentiating factors between some of the caps that are out there.
Yeah, I know someone with scarring alopecia.
Yeah.
She's actually in one of my support groups, and she swears by this hat with the red
Yes.
light inside of it. It's like a baseball hat, and she's like,
Yes.
I just put it on every morning, walk
Right.
around with it, do whatever she has to do around the house. But she loves it because she has said it helps so much with her inflammation.
Right.
Because at
That's it.
at one point she could not even be in the sun because the sun
Wow.
would burn her scalp. So after she's been using the red light therapy, she
Yeah.
doesn't have those problems anymore.
Yeah. I believe in it. But again, you have to be discriminating to make sure that you're getting your money's worth, a good value.
Right.
Yeah.
Exactly. Exactly. Now, can you explain how FUE, that
Yes.
technique, is adapted for your eyebrows and your beard compared to the scalp transplants? And what are
Uh-huh.
the key technical differences?
Yeah, so it's so funny because, we do all of these procedures and we might do 2 or 3 thousand grafts on someone's head and it takes us all day. You know what I mean? Like it's an 8 to 5 sort of thing, or maybe it's a 7 to 7 sort of thing if we're doing 3,000. And honestly, when we do eyebrows, it's about 300, 500, depending on the look that somebody wants and kind of what they're starting with. So I
Okay.
always think in my head, oh, it's going to be fast. If it takes me 8 hours to do 2,000 grafts, then we should be done by the morning or the afternoon. But
Hmm.
because of the placement, this is the focal point. This is the focal point. So
Yes.
everything has to be so precise. It really takes me a morning or an afternoon to place these exactly the way that I want them to be. So it takes more technical skill. Obviously, there's technical skill with scalps as well. It's just a little bit more forgiving. And
Hmm.
on your face, precise. Nothing but
Yeah.
the best. Yeah.
Yes. So are the people who come to you for the eyebrows and the beard, are these people who they may have like alopecia, or is it just that they have thin eyebrows, or like what are usually those circumstances?
Yeah, yeah. So most of my patients that progress to surgery are usually just androgenetic. So we're just getting older. It runs in my family. It could be the mother side, the father side, but for whatever reason, they're just having some thinning situations. I try to, again, I address all the medical issues right up front. We actually just picked up a brain tumor in someone who had a little bit more prolactin than I was expecting. So when we did my normal workup, I don't even know how long it would have taken us to pick this up
Hmm.
outside of my workup. But, we can pick up some things, not just
Right.
thyroid, but other issues that could be problematic. With the
Hmm.
alopecia, with Olumiant, we have some really amazing new therapies that are approved. And you probably know really well the JAK inhibitors. So whether
Yeah.
you're using them orally, we've been compounding some of them for some of my traction alopecia patients. Applying topically, we're seeing
Hmm.
good growth in some really tough to treat patients. So I'm very intrigued by the JAK inhibitors specifically in terms of hair growth and alopecia
Okay.
and the immune aspect of that. And then there's some JAK3s that are coming out that also have some really good data behind them. So I'm watching the clinical trials there, and hopefully we'll have more to share with your audience soon.
Okay, okay.
Yeah.
Now, what makes a good candidate for the eyebrow or the beard FUE transplant? And like, does it matter in regards to the hair texture or the skin type or any of those things?
Yeah, so for the most part, when I'm doing those transplants, I'm pulling from what I call the forever hair. So if I put my hands by my ears and sort of
Hmm.
around the back, and if you look a picture of my husband, that's the hair he has left. Okay. So I love
Okay.
him, but this is the hair that he has left. This is
Hmm.
called forever hair because it's not affected by age, stress, or genetics. Okay.
Okay.
So when we move hair, and I'm basically moving the furniture, is how I describe it to people, I'm taking from that forever zone and it retains the characteristics of forever hair. So wherever I put it, like your eyebrows, for example, I did my
Hmm.
own eyebrows. And what was really funny is I'm thinking, oh my gosh, I'm going to be 120, but my eyebrows will be great forever, right? Um, So I'm looking for someone who has enough hair to donate for whatever procedure that they need. And then, of course, we've been working with the Vigidine or the Vortiporfin, which is a way for me to regrow hair in that donor site for people that have already had transplants. And I'm also using a dermal incision technique where I make small wounds. And because of the mechanism of action of this Vigidine or Vortiporfin, it regrows hair in the area that's been wounded. So I've actually been growing hair with and without transplant in brows. I've actually done some eyelashes, and then I'm doing a lot of hair. You can see that on my Instagram, Dr. Melissa Toyos.
Okay. All right, great. So you guys, you heard that. Check her out on Instagram. Go see her work because she may be able to assist you if you're in the Nashville or Memphis or New York
That's
area.
right. Yeah, got to be close to somebody somewhere. Yes,
Right, somewhere, right?
somewhere.
Okay, so now you've also led clinical trials
Right.
and informed the FDA decisions. Are there any like recent upcoming innovations in hair restoration or devices that you want to talk about that you're excited about? I know you just talked about Jack threes. So
Right.
is there anything else, or you want to explain more about that?
Yeah, yeah. So really, I'd love to talk about the verteporfin because this is really intriguing to me. It's an old macular degeneration drug. So back to the ophthalmology, going into hair and
Hmm.
aesthetics. This medicine was used IV for people who had certain eye conditions, and it was helpful to them, but it's been replaced by better medications. And then there was a doctor at Stanford who was looking at maternal fetal medicine, noticing that some babies scarred when they had in utero surgery and some did not. And he
Hmm.
started elucidating the pathway there, and he found the pathway. And then he also found one of the enzymes that triggers scarring. And when you have scarring, then that skin is different. It doesn't grow hair, it doesn't have sweat glands or oil glands. And so
Hmm.
he was able to inhibit that with this medication, verteporfin, that happens to be an old eye drug.
Okay.
So we started playing with that about 3 years ago, and because I had familiarity with it, and there were other hair transplant surgeons around the globe that were starting to look at it, looking at pigs. And what was so fascinating is that they would make a wound, they would inject this medicine around the wound, and then it would
Hmm.
heal better, like with more natural skin, and you would have
Okay.
hair growing there. So I was like, sign me up, right?
Right.
So I've been playing with it ever since, and now I'm combining it with my transplants to regrow the donor hair because that's been a limitation before that you only had so much hair back here that you could donate before you ran
Hmm.
out. So if we can regrow some hair to maybe move to the front, that's been helpful to some of my patients. And
Okay.
for some of my patients, I'm just making these wounds all over the scalp and injecting that medicine, and we're regrowing hair just without a transplant. So having more options has been very interesting to me and finding the right dose. We've been able to regrow hair as much kind of as people are wanting. So I'm noticing, if I get some hair here, but patients are like, wow, this is good, but I want more. Each
Mhm.
time I do it, we get more and more hair growth. So that to me is very interesting. I think ultimately, one day, Kelly, like our phones are just going to AI make some hair and just we'll put them in, it'll just be like
Yes.
the little 3D printers and we'll make as much hair as we want. But there's a
Uh-huh.
lot of scientific hurdles right now about the immune reaction, being able to place things, how the follicles sit, and just the survivability of a lot of good treatments. So a lot of things have tried and failed, but that's science. Some things work, and then it's the process of figuring it out.
Right, right. Okay, so I have two follow-up questions to that
Yes.
one. So when you say you inject the back to regrow hair so that you have
Right.
enough hair to transplant, how long, like when do you have to start doing that? Do you need to give it 2 or 3 months, or does it need to be
Yeah.
longer before you can really transplant that hair?
That's super. So here's what I'm finding just in general with the dermal incision plus the verteporfin technique that I've been playing with. When we talk about hair, and your audience will know this, we talk about 1 and 2 years, right? Like you maybe start to see something in a month, maybe 3 months, but full results are going to be consistent use up to 1 and 2 years after a transplant or starting minoxidil, finasteride, propecia, whatever it is that you're doing. But with the verteporfin dermal incision technique, I'm starting to see a little something at 1 month. I'm
Mhm.
putting most of my before and after pictures at 8 weeks, so a 2 month follow up. So that's
Okay.
pretty quick. And then I feel like I've gotten the maximum results there in about 3 months. So I like to let things settle, and I wouldn't try to transplant that hair until it had been about 6 months, just so we're not doing too much. And I want to
Yes.
realize kind of the full benefit of all the hair growth there. But that's really what I've been doing in my practice.
And that makes sense. I was thinking 6 months, yeah, that would be a good amount of time. Now, when you do these scars in the scalp,
Yeah.
and this is a question I always ask because
Yeah.
scarring alopecia, is a whole different
Sure.
beast, right?
Right.
So
Right.
for my people like myself who want to know, like, would this work for scarring alopecia patients, or does it
Yeah.
depend on what stage they're in? Can you explain that a little bit?
Yes, 100% it's going to depend, right? Depend on kind of where you are in the process and how active the process is at the time. But
Mhm.
what the verteporfin is doing is reducing the activity of the fibroblasts, which are the cells that are triggered whenever we have a trauma, and that's what
Mhm.
causes the scar. So it's very interesting because I'm making a wound, but what I'm also finding is it's softening up scars that already exist because like
Okay.
new skin is developing behind there. And again, with the new skin, we're getting all the skin structures that come along, like with hair. So that intrigues me for patients that have dealt with scars. I
Mhm.
feel like we can soften that up, and that a new follicle that goes into that area is going to be more receptive. The skin is going to be more receptive because it's not quite as hardened and scarred. So I think, and I don't know because I haven't done this study yet, but I think that we're going to have better efficacy rates, probably not the same as someone who never had any scars before, but
Mhm.
also I think better for people undergoing transplants if we can reduce the scarring just overall as a process. I mean, why
Mhm.
wouldn't you want to, right? And
Exactly.
yeah, and when I think about that, I actually had the benefit of talking to one of the inventors or the founders of the verteporfin. It's only been it's been within our lifetime, so that was really interesting. They envisioned it being used in general surgery to prevent all scarring, like when you go get your gallbladder taken out or
Mhm.
anything else. I was thinking about plastic surgery, like what if you never had another tummy tuck scar? But the medicine is fairly expensive, and using it in big areas can be problematic, but it's manageable to do the scalp.
Okay, okay. And that would be awesome because people have surgery all the time, like, for different
Right.
reasons, and a lot of times people have or get keloids, from
Yes.
scar and tissue, so that would help and reduce that, right? Or maybe potentially eliminate that. Am I correct by saying that?
It's hard for me to say because I haven't done a full study on that, but I
Okay.
have been working with a lot of my patients that have scars, hyperpigmented scars, atrophic scars. We are seeing improvement. And then that actually opened up a whole different universe to me because as I started working with verteporfin, there are subreddit columns, people around the globe that are pooling their knowledge. A lot of them are very scientific and doing research as well. So we've been compounding a lot of products, losartan, metformin,
Hmm.
some of the peptides and combining that with my mixed dose CO2 laser, you can see that behind here, to
Hmm.
try to reduce scars, whether they're early or late, acne scars, trauma scars, just improving the look and the texture of scars that are occurring that people don't love.
Okay, okay. Ooh, cool.
That's a whole different, it's a
Right.
whole different ball of wax. Yeah.
Technology and research
Yeah.
development, those are wonderful things.
Right, right. What are the edges? What if? What's possible?
Exactly,
Yeah.
exactly. All right, so let's switch over a little bit and we're going to talk about cost and timing. So,
Yeah,
cost and timing are huge practical concerns for people. So,
sure.
how do you help patients weigh the financial investment of multi-modality care
Yeah.
or surgery versus slower non-surgical approaches? And what is the typical timeline you see for meaningful change? And I know you just talked about 1 to 2 years.
Yeah. Right. I think for topical medications and oral medications, I do talk about consistent use, 1 and 2 years. Truly, that's what I talk about with transplants as well. So when people get transplants, even though it's immediate, those follicles have to get situated. They have to get to know their neighbors. They have to like all get on the same cycle, sort of. So
Mhm.
that really is a 1 and 2 year process as well. And if you add some of the orals, we have good data now that it will help your transplant grow faster. And we're using products from LockRx like exosomes, the little vesicles that people are using to help grow hair faster and to improve their chance of survivability. So there's a lot of different things we can do to tweak that. And yeah, I think consistent use and when people are thinking, sometimes people don't like to do something every single day. That's more of my men, honestly, because I think women are used to doing something. Yeah.
Exactly.
Yeah. So it's a little bit different conversation there.
Okay, okay. Now I know just in the past and just being around and talking to different people, a lot of patients who are on a treatment plan, let's just say for their hair loss,
Right.
and that treatment plan may not be working out. And I always try to tell people, give it more time. Like I always say, give it at least 6 months
Yep.
before your doctor probably will change your treatment plan. Do you
Right.
think it should be that 1 year instead of that 6 months, or
6 months
just
is
10?
exactly the number I had in my head. As
Okay.
you were speaking, that's the number that I had. And I think, again, because of timing and because I kind of liken this to fertility a little bit. There's windows of things, and especially if you're dealing with a medical condition, you don't want things to go too far before you make an adjustment. So I would make an adjustment at 6 months, whether that would be adding or changing. We would talk about that with the patient. We would make that decision together. But I think 6 months is a really good time. I like to check on my patients at 1 month, at 3 months, at 6 months, and then just depending on how they're doing, 9 and 12.
Okay. Okay. So good. I'm glad that information was correct.
We're
Like,
on the same
has
page.
anything changed, right?
Yeah.
All right. So my final question to you is, for our listeners who are navigating hair loss right now, what are
Right.
5 actionable steps that they can take this week? It could be medical, lifestyle, or surgical assessments to start a scientifically sound plan to improve their density and scalp health.
Yeah, well, I would just say congratulations. There's never been a better time to embark on that journey. We have more
Hmm.
tools now than we've ever had. I think first, go find a trusted professional. Find someone that you trust, that you have a good relationship with. They're going to talk to you about all of the options, right? Some people very surgical, some people are very medical, but you want to find someone who can really help you navigate all of your options and find what resonates with you. Get a very thorough medical workup. Again, you don't want to miss anything that would be easy to fix, like a copper deficiency or zinc or selenium. I see that quite a bit. Picking up thyroids. A lot of times, women our age will be on the low end of normal, and even just addressing that, even though they're in the normal range, can make a difference to their hair. So I think those two things would be right where I would start. I love my gene test because, again, nobody wants to waste money on things that are not going to be super effective. I like a very
Right.
targeted scientific approach. We're doing that with cancer now, where we literally get signatures of cancers and we can individualize treatment plans. So I think the closer we get to that with hair, the better it is for patients and the faster you'll see results because we can customize it for you. I just created I compound Rogaine, and if you add vitamin A, you'll double the effectiveness of that. We add other products in as well. But I just had one patient do a gene test and we added in melatonin because it turned out she was responsive to that. So again, that can help you save some time. I think if you're getting a red light cap, make sure you get a good one. So that will save you quite a bit of time as well. And gosh, for the fifth actionable item, make a consult with Toyos Clinic. We'll talk all about it.
Yes, yes, of course.
Yep, just a little
And to,
plug.
yes, and to your point, going to see a professional very early. I always say that is always the first step. If you notice you are getting your hair is thinning or something's going on, go speak to a professional about it as soon as possible.
Right.
Because I was a person who did not do that. I was in denial and did not do it. So I always say that that's step number one. And then my
Yeah.
other thing is that, to your point, I wish that all of this was available back 20
Yeah.
years ago, or, because
Right.
this would have been so helpful for people like myself who started losing hair back then. But I am so happy that it is here now because
Yeah.
it's so beneficial for people who are currently experiencing hair loss and could save their hair.
Yes, I agree. And you wear it beautifully.
Thank
I'm
you.
curious about your process because I think that happens a lot, like denial and alopecia, and I don't want to see that. And
Hmm.
if I do something different, maybe it will go away. And you're right. I think the earlier we get in and intervene, the better. And some of the stars, some of the celebrities that have been open about their hair loss journeys as well, I think have
Hmm.
helped raise awareness. And honestly, I have daughters that are in their 20s and they are not afraid to raise their hand. I think think there's less stigma attached to these medical sorts of things. So I'm going to credit you for that as well. You're helping to raise awareness and you're
Thank
creating
you.
that community. And I think that that's an amazing thing that you've done.
Thank you so much. Yeah, I want to make sure that women know there are options. You can go see people, and I have people on the podcast that you can go directly to. So if you
Right.
need help, contact them. That simple, right?
Yes, and they benefited from your journey, right? All of the steps that have you're able to kind of help them with shortcuts and help save them some time and stress and trauma.
Definitely, definitely. Well,
Yeah.
thank you so much, Dr. Toyos, for coming onto the Bougie Body podcast. And for those who are out there listening, I will put all of Dr. Toyos' information, her contact information, her Instagram, website, all of that will be in the show notes. So if you guys did not catch it during this episode, make sure you check the show notes and grab those links, okay? And before we leave, I got to make sure I mention that the Bougie Body Show is officially out. So if you've been listening to the podcast, the Bougie Body Show is an extension of the podcast. We have women on there on panels who have actually experienced hair loss, and we are out there telling our real stories, sharing our experiences, giving advice, uplifting the community. So make sure you go check it out, okay? It is on the Zandra TV network. If you have Roku, Apple TV, or Apple TV, simply go to your app store, download Zandra TV, and you will find the Bougie Body Show. So don't worry, this will be in the description of the show notes as well. So you guys can follow those instructions just by going to the show notes. So that's what we have for today for the Bougie Body Show. I want to thank you guys for tuning in, and we will see you next week. Bye.
Thanks, Kelly.
Thank you for listening and watching the Bougie Body podcast. I appreciate you as an audience member. Now, make sure you go and check out the Bougie Body TV show. You can watch it from any device, any smart device. All you have to do is go to ZandraTV.com and you will be able to pull up my show. It is under the lifestyle section on the menu if you don't see it on the front page. So make sure you go check it out. And if you did not get it, it's ZandraTV.com. Go ahead and click on the link in my show notes if you want to make it easier for yourself, and it'll take you directly there. I will speak to you on the next episode of the Bougie Body Podcast. Bye.
Thank you for watching the Bougie Baldy podcast. Don't forget to subscribe